Chapter 2. The first cause of imbalance, physical factors. Based on the book Massage Therapy according to 3 causes of imbalances. Welcome to Chapter 2 of Massage Therapy according to 3 causes of imbalances. In this chapter, we begin exploring the first major source of dysfunction within the body, physical imbalance. Physical imbalance develops from posture, injury, repetitive strain, overuse, and biomechanical compensation patterns. These dysfunctions are among the most common issues massage therapists encounter in clinical practice. Throughout this chapter, we will focus on assessment, pattern recognition, and selecting appropriate therapeutic approaches based on tissue presentation and functional imbalance. Let us begin with learning objectives. By the end of this chapter, you should be able to identify common signs of physical imbalance, explain the relationship between agonist and antagonist muscle dysfunction, and select appropriate massage therapy techniques based on tissue condition and injury stage. The goal is not simply to memorize muscles or techniques, but to begin thinking clinically and functionally. Next, scope and safety reminder. Before discussing treatment approaches, it is important to understand the professional role of the massage therapist. Massage therapists work to improve comfort, movement, circulation, and functional balance. However, massage therapists do not diagnose disease or structurally correct the body. Recognizing limitations within our scope of practice is essential for both ethics and client safety. Knowing when to refer a client to another healthcare professional is part of responsible clinical practice. We will continue with referral considerations. Certain presentations may require immediate caution and possible referral. Sharp or worsening pain, numbness, tingling, or weakness may indicate neurological involvement. Open wounds, fractures, or recent surgical sites may contraindicate treatment. Unexplained swelling, redness, fever, or dizziness may suggest systemic conditions that require medical evaluation. Massage therapy should never replace appropriate medical care when red flags are present. Now, it is important to understand physical imbalances as a massage therapist. Physical imbalances are often the most visible and measurable forms of dysfunction in massage therapy. These imbalances may develop from poor posture, repetitive movement, traumatic injury, or chronic muscular overuse. Over time, the body adapts to stress. If these adaptations continue unchecked, compensation patterns begin to spread throughout the body, affecting movement efficiency and tissue health. Next, we will address common indicators of physical imbalances. Common indicators include chronic muscular tension, reduced flexibility, restricted range of motion, and joint discomfort. Postural distortions often emerge gradually and may eventually contribute to pain patterns, compensation, and repetitive strain injuries. The body always attempts to adapt to stress, but adaptation is not always healthy. Now that we covered common indicators of physical imbalances, we will continue with physical stress cascade. This figure illustrates the progression from stress to dysfunction. Initially, postural stress creates muscular adaptation. As tension continues, facial densification begins to develop. Eventually, compensation patterns emerge, and pain becomes more noticeable. One important clinical concept is that pain often appears later in the dysfunction process, meaning compensation may already be deeply established before symptoms become severe. Next, we need to talk about the importance of understanding the difference between agonist and antagonist muscle roles. Agonist muscles create movement through contraction. Antagonist muscles regulate and control movement by lengthening and balancing the action. When this relationship becomes disrupted, imbalance develops. Overactive agonists may become shortened and hypertonic, while antagonists may become overstretched, fatigued, and ischemic. Understanding this relationship is critical for proper treatment planning. Next, we will address clinical relevance of tension patterns. Overactive muscles can alter joint mechanics and posture. Meanwhile, antagonistic muscles experience chronic eccentric loading and fatigue. An important clinical concept is that pain frequently appears away from the primary source of dysfunction. The area that hurts is not always the area causing the imbalance. This is why assessment and observation are essential. Common tensor imbalance patterns. This table presents several common imbalance patterns. For example, forward head posture commonly involves overactive sternocleidomastoid and upper trapezius muscles, while the deep neck flexors and rhomboids become weakened or inhibited. Anterior pelvic tilt often involves tight hip flexors and lumbar extensors combined with weakened gluteals and abdominals. Recognizing these predictable patterns helps therapists create more effective treatment strategies. Now, it is time to cover massage applications for agonists and antagonist muscles. When working with overactive agonists, inhibitory techniques are commonly used. These may include stripping, compression, trigger point therapy, or deep tissue approaches. The objective is to reduce excessive tone, guarding, and neurological overactivity. The goal is not to attack tissue aggressively, but to encourage relaxation and normalization. In contrast, antagonistic muscles require a different approach. Because these muscles are often already overstretched and fatigued, aggressive stretching may worsen dysfunction. Instead, treatment should focus on improving circulation, restoring neuromuscular coordination, and supporting functional tone. This is an important clinical distinction many beginning therapists overlook. How about cupping therapy and PNF integration as a complementary approach? Cupping therapy may also support treatment goals. Static cupping is often useful for hypertonic primary tensors. Dynamic cupping may help lengthen antagonists by improving circulation and tissue mobility. Cupping may also influence nervous system regulation and facial hydration. Proprioceptive, neuromuscular facilitation. PNF techniques, such as contract relax and hold relax methods, can reduce muscular tone and improve flexibility. These techniques use neurological principles like reciprocal inhibition to encourage relaxation. PNF is generally most effective after tissues have been warmed and prepared. The following section will address postural pattern reference. This part reviews common postural patterns. Forward head posture, rounded shoulders, and anterior pelvic tilt are among the most common dysfunctions seen in clinical practice. Each pattern contains predictable muscular overactivity and underactivity, allowing therapists to organize treatment approaches more effectively. Next, postural dysfunction continuum. Postural dysfunction usually develops gradually. The body often progresses from neutral alignment to mild dysfunction and eventually into chronic strain patterns. Early stages respond well to awareness, ergonomics, and education. Later stages may require more focused therapeutic intervention. Next, injuries and movement restrictions. Injuries frequently expose underlying imbalances that already exist. Massage therapy may support recovery, improve circulation, reduce guarding, and prevent secondary compensation patterns. However, assessment must always guide technique selection and pressure application. Therapeutic focus by postural stage. Different dysfunction patterns require different therapeutic goals. Some clients require inhibition of dominant muscles, while others require stabilization, neuromuscular retraining, or movement education. Treatment should always match the functional presentation of the client. Additionally, the injury continuum. Injuries progress through stages including acute, subacute, chronic, and compensatory phases. Each stage requires a different treatment approach. Acute stages require gentler, supportive methods. Chronic stages may tolerate deeper facial or adhesion-focused work. Therapists must respect tissue readiness and healing timelines. Next, understanding the injury continuum. In the acute stage, massage focuses on comfort and swelling reduction. During the repair phase, circulation and gentle mobilization become more appropriate. Chronic dysfunction may require adhesion reduction, facial release, and movement restoration. Post-injury compensation patterns often require broader kinetic chain assessment. How about repetitive strain and occupational stress? Repetitive strain injuries develop from repeated low-load stress over time. Poor ergonomics, inadequate recovery, and repetitive movement patterns contribute significantly. Finally, massage therapy can help interrupt dysfunctional movement habits and improve proprioception. Can muscles create memory pathway? The answer is yes. Repetition creates neurological encoding. Over time, these patterns become automatic and may restrict movement efficiency. Massage therapy can interrupt dysfunctional patterns and help the nervous system reorganize movement. This is why therapeutic massage is both mechanical and neurological. The next two sections will cover massage tools for repetitive stress, followed by techniques and approaches. Several techniques are effective for repetitive strain dysfunction. These include stripping, compression, pin and stretch, positional release, and instrument-assisted methods. Each technique has different goals, ranging from improving circulation to restoring facial mobility and reducing protective spasm. Effective treatment begins with assessment. Therapists should work systemically rather than focusing only on isolated symptoms. The body adapts through compensation, so treatment should support adaptation and balance rather than forcing correction. Technique categories. Different dysfunctions respond better to different approaches. Postural imbalance may respond well to myofascial release and muscle energy techniques. Chronic tension often responds to deep tissue and trigger point work. Adhesions may require friction therapy or cupping techniques. Pressure scaling gradient. Pressure selection should always match tissue condition. Acute injuries require lighter pressure. Subacute conditions may tolerate moderate pressure. Deep pressure should be used cautiously and only when tissues are ready. More pressure is not always better. Now it is time to compare what we have learned to specific case studies. Case study, tech neck. This case study demonstrates a common forward head posture pattern associated with prolonged device use. The client presented with overactive sternocleidomastoid and upper trapezius muscles along with rounded shoulders. Treatment focused on decompression, postural awareness, and restoring muscular balance. Next, case study on chronic low back pain. This client demonstrated anterior pelvic tilt and excessive lumbar lordosis. Overactivity within the quadratus lumborum and hip flexors contributed to compensation and pain. Treatment focused on restoring pelvic balance and improving movement mechanics. The last case study, repetitive strain injury. This case involved repetitive overuse of the wrist extensors. Trigger points and facial congestion restricted movement and produced pain. Through targeted massage techniques and movement restoration, function improved without requiring interruption from work. Now, it is time for our chapter reflection, following by knowledge check questions. As you review this chapter, begin observing posture and compensation patterns in everyday life. Practice assessment skills with classmates and continue thinking critically about technique selection. Remember that successful treatment begins with understanding function, compensation, and adaptation. Knowledge check questions. The final sections review important concepts from this chapter. These questions reinforce understanding of scope of practice, postural dysfunction, agonist and antagonist relationships, injury stages, repetitive strain, and treatment philosophy. As you answer these questions, focus on clinical reasoning rather than simple memorization. The ultimate goal is to think like a therapist, not just perform techniques. Question number 1. Which statement best describes the scope of massage therapy in this chapter? A. Diagnose disease and correct structural deformities. B. Support functional balance and comfort within ethical boundaries. C. Prescribe medication and manage pathology. D. Perform joint manipulation to realign the spine. Take a moment to reflect on your answer. The correct answer is B. Support functional balance and comfort within ethical boundaries. Question number 2. Which presentation should prompt referral rather than continued massage? A. Mild tightness after exercise. B. Gradual stiffness that improves with movement. C. Numbness, tingling, or motor weakness. D. Localized postural tension from desk work. Take a moment to reflect on your answer. The correct answer is C. Numbness, tingling, or motor weakness. Question number 3. Which is a common indicator of physical imbalance? A. Fever with sudden fatigue. B. Limited range of motion and movement discomfort. C. A confirmed medical diagnosis label. D. A normal, effortless gait. Take a moment to reflect on your answer. The correct answer is B. Limited range of motion and movement discomfort. Question number 4. In the agonist-antagonist relationship, the agonist is the muscle that A. Initiates movement through concentric contraction. B. Always lengthens to regulate movement. C. Only stabilizes and never mobilizes. D. Cannot become hypertonic. Take a moment to reflect on your answer. The correct answer is A. Initiates movement through concentric contraction. Question number 5. A hypertonic primary tensor most commonly leads to which pattern in the antagonist? A. Improved endurance and strength. B. Chronic eccentric load with fatigue and ischemia. C. Permanent relaxation and softness. D. Immediate tissue regeneration. Take a moment to reflect on your answer. The correct answer is B. Chronic eccentric load with fatigue and ischemia. Question number 6. Which example best matches a forward head posture pattern? A. Overactive iliopsoas with underactive glutes. B. Overactive SCM and upper trapezius with underactive deep neck flexors and rhomboids. C. Overactive hamstrings with underactive quadriceps. D. Overactive tibialis anterior with underactive gastrocnemius. T. Take a moment to reflect on your answer. The correct answer is B. Overactive SCM and upper trapezius with underactive deep neck flexors and rhomboids. Question number 7. Which technique approach is most appropriate in the acute injury stage? A. Direct deep work into inflamed tissue. B. Aggressive stretching to restore range immediately. C. Indirect work to support comfort and reduce swelling. D. High-intensity cross-fiber friction over the injury site. Take a moment to reflect on your answer. The correct answer is C. Indirect work to support comfort and reduce swelling. Question number 8. The muscle memory pathway described in Chapter 2 emphasizes that repetition can lead to A. Reduced neural encoding. B. Restricted movement through neurologically reinforced patterns. C. Instant correction of posture. D. Elimination of compensation without intervention. Take a moment to reflect on your answer. The correct answer is B. Restricted movement through neurologically reinforced patterns. Question number 9. Which sequence reflects the treatment philosophy presented for physical correction? A. Diagnose, prescribe, correct. B. Soften, awaken, integrate. C. Stretch, crack, stabilize. D. Deep pressure, ignore feedback, finish quickly. Take a moment to reflect on your answer. The correct answer is B. Soften, awaken, integrate. Question number 10. Which outcome best represents successful intervention for physical imbalance? A. Improved ease of movement and coordination. B. A definitive medical diagnosis. C. Permanent structural correction in one session. D. Maximum pressure tolerance regardless of tissue response. Take a moment to reflect on your answer. The correct answer is A. Improved ease of movement and coordination. In closing, Chapter 2 introduced the foundational concepts of physical imbalance and the role massage therapy plays in supporting movement, posture, and functional recovery. Understanding these principles provides the clinical framework necessary for effective assessment and treatment planning throughout your massage therapy career.
How